Welcome, folks, to today's mini lecture on marijuana, otherwise known by many names: reefer, pot, herb, or herb, depending on which side of the Canadian border you are on. It is also known as ganja, sensibilia, sensi. It comes from the Latin family name Cannabaceae, and its genus names are Cannabis sativa and Cannabis indica. There is a long and rich cultural history associated with marijuana. It is thought to be the world's oldest cultivar, going back over 10,000 years. Cannabis, the word, is thought to derive from the Hebrew word kanichoshum, meaning aromatic reed, and the Greek word cannabis with a K. Some cultures throughout the world even go so far as to believe that humans are descendant from cannabis, given the relationship between the five-fingered leaf and the five fingers on our hands. And there are many different indigenous cultures in the world who believe that humans, that all creatures, are descendant from plants, as plants were here before, and we would not be able to survive without the plant kingdom. So, what are the physiological effects of marijuana? Marijuana in small doses has been found to be an effective antidepressant. However, in large doses, it has been found to be a depressant. The same goes for marijuana when discussing its qualities as an aphrodisiac. In small doses, it functions as an aphrodisiac, and in large doses, it functions as an anaphrodisiac. It also functions as a vasodilator. It has antispasmodic and pain-relieving qualities, and is also a hypnotic, a hallucinogen, euphoric, and a cerebral sedative. So the effects vary depending upon the person, the dosage, and the potency of the herb. It dilates the blood vessels and the alveoli sacs in the lungs, resulting in deeper respiration and an increase in heart rate. Because the blood from the lungs goes directly to the heart and the brain, the THC and other compounds within cannabis go to the brain and the heart, and their effects are felt within minutes. In general, smoking marijuana will first relax a person and elevate her or his mood, followed by 30 minutes later, a feeling of drowsiness and sedation. Some report feeling stimulated, followed by a relaxed feeling of tranquility. Studies show that marijuana does have negative effects on learning and memory. The mental functions affected by marijuana primarily include learning and memory. And studies show that adolescents are at greater risk of suffering from THC-induced impairment of their learning and memory, as the frontal lobe of the brain is not fully developed until about 24 years of age. So the cannabis plant contains over 400 different compounds, several of which are psychoactive. The most commonly known psychoactive chemical compound in marijuana is delta-9 tetrahydrocannabinol, or THC, which is found in the plant's resin and is most concentrated in the flowers, in the buds. Another commonly known chemical in marijuana is CBD, or cannabinoid. Cannabinoid is a result of the cannabidiolic acid that's formed early in the plant maturation. It is then converted into CBD prior to its conversion into THC. THC has a higher level of psychoactivity than does CBD, which is why we are able to go to the grocery store, or in some places the gas station, and buy CBD products over the counter, which are commonly used, again, for pain relieving as well as relieving anxiety. When marijuana is smoked, again, it is absorbed into the blood supply through the lungs, travels to the brain and the heart, and creates the psychological and physiological effects that are known as being high. Although much of the THC is gone from the brain within a few hours, it does accumulate in other parts of the body. It accumulates primarily in the organs of the liver, the kidneys, the spleen, and the testes. It also accumulates higher in highly concentrated fat areas of the body. So a person who has a higher percentage of fat is going to retain the THC molecules in their body for a longer period of time than someone who does not have a higher percentage of fat in their body. One of the most surprising research findings on cannabinoids has been the discovery of the cannabinoid receptors in the brain and other parts of the body. Specifically for women, cannabinoid receptors have been found in the uterus. So what this is now termed is it's now termed the endocannabinoid system. So the interesting thing about having receptors in the body is that when our bodies have naturally occurring receptors for a specific chemical, it must also produce the chemical compound which will activate the receptor. So the naturally occurring chemical in our bodies is known as anandamide. Anandamide. So ananda is an ancient Sanskrit word which translates to bliss. So anandamide is the one compound naturally occurring in the brain and the rest of the body that binds with the cannabinoid receptors, the endocannabinoid system. Another one that is known is called 2-AG, and there are also other subtypes that have been found. Marijuana affects the specific brain regions of the hippocampus, the cerebellum, and the basal ganglia areas. And again, it also affects the immune system, the heart, the lungs, and the reproductive system, as well as a person's subjective internal experience. Tolerance to marijuana can be developed over time, and withdrawal symptoms do occur. However, they are mild withdrawal symptoms, especially in comparison to the withdrawal symptoms that would occur with drugs like opiates or sedatives like benzodiazepines, nicotine, and even alcohol. So in general, although some individuals report experiencing psychological dependency, or what we could also term as behavioral dependency, a behavioral addiction, in general, people do not become chemically dependent to cannabis, unlike with other drugs, again, opiates, benzos, nicotine, and alcohol. Most commonly, heavy daily smokers will report experiencing mild withdrawal symptoms after abstaining from cannabis use for 3 days or more. Some of the common withdrawal symptoms that are reported by these users are headaches, trouble sleeping, and a decrease in appetite, as well as overall emotional and mental irritability. So some people will commonly say that marijuana is a natural occurring substance used to self-medicate. It does have medicinal properties and can be used as a medicine in appropriate doses when prescribed by professional healthcare practitioners. So how does it affect the body? Why is smoking marijuana a pleasurable experience for many people? So research has found that marijuana, THC, and the cannabinoids affect the body, the reward system, the nucleus accumbens, the ventral tegmental area, in the same way that we've discussed with previous substances, specifically with alcohol. So it is processed as a positive chemical in the body and causes a release of dopamine in that portion of the brain, which the brain and the body then translate as a reward, as positive reinforcement, as well as the fact that it does create a euphoric, slightly hallucinogenic, and pain-relieving experience. It is one of the more mild drugs that a person can choose to use, self-medicated or prescribed, for some of the conditions that we will discuss here in a little bit. But again, it is still illegal in the United States, and for a long time was considered a Schedule 1 substance, and although it is legal in some states, it is still considered a Schedule 1 substance by the FDA. So there's a lot to say about cannabis, both as a illegal drug as well as a medicine. Please read the chapter as well as the links on cannabis, as it is a diverse topic that we could discuss for way more than 10 or 15 minutes of a mini lecture. It's interesting to note that in the late 1980s, when cannabis was being up for debate in the Supreme Court, that there was a judge whose name was Francis L. Young. He was the administrative law judge for the DEA, and after 2 years of trial, what his conclusion was that marijuana is one of the safest therapeutically active substances known to man, and that marijuana fulfilled the legal requirement of currently accepted medical use. However, his order that marijuana be moved to the Schedule 2 was ultimately overruled by the DEA. So again, before we end this, I'd like to read a passage from Buzzed that highlights the dangerous potential effects of marijuana in comparison with some of the other more highly addictive substances that we are discussing throughout this semester. So one area of the brain that is involved in rewarding and possibly addicting effects of some drugs is the nucleus accumbens, which contains cells that use the neurotransmitter dopamine. Until recently, there was no evidence that THC had any effect on dopamine activity in this region, leading many people to believe that marijuana carried no risk of addiction at all. Although the jury is still out on whether marijuana is addictive, there are some studies in animals that indicate it can increase dopamine levels in the nucleus accumbens. Remember that when it comes to science, it is never wise to bank on the results of just a few studies. But those reports at least raise the possibility that THC has some effect on the brain's reward system. If so, then marijuana may join the long list of other things that stimulate these circuits, including nicotine, food, heroin, sex, and alcohol. We expect that scientific research will eventually show that anything pleasurable, even a good biscuit, will evoke dopamine. And if the pleasurable experience is repeated enough, then withdrawal from it will produce discomfort. Who wants to give up tasty food? But the key here is a matter of degree. Maybe food, sex, and marijuana release some dopamine in the reward circuit, but cocaine is so much more effective that it is therefore much more addicting. As we continue to emphasize, good information is critical to making healthy decisions. And just because someone concludes that marijuana may stimulate the reward circuit, we should not infer that this drug is the pharmacological equivalent of other drugs, like heroin and cocaine. Thank you all very much for your time and your attention during this introduction to marijuana mini lecture. I look forward to discussing this topic with you in greater detail, specifically during the last week of this semester, of this course, when we review the substances. If you should have any questions on the substance of marijuana, its history, the legal implications, its medical uses, and its addictive properties, as well as treatment, please feel free to reach out to me at my email, stephanie.lingenfelter@northernvermont.edu, or you may comment below the video or within the discussion group in our Moodle course. Again, thanks very much, and enjoy the rest of your day.